Thank you all for joining us here today. My name is Taylor Gage. I'm Director of Strategic Communications for Governor Ricketts. In just a moment, we'll get the program started here. Joining Governor Ricketts here today will be Steve and Ann Schrader, who are going to share their story about their experience with the coronavirus, as well as Tara Whitmire, who's representing nurse practitioners. It's Nurse Practitioners Week, and we're going to be highlighting the great work that they've been doing throughout the pandemic. Just a reminder that we'll start with questions that were submitted ahead of time, and then I will also be moderating questions, repeating them into the microphone for the governor to answer them as well when we get to the Q&A period from folks here in the room. And if you're broadcasting, please keep sharing in your shot throughout the program. And with that, we'll get the governor to kick things off.
Needs it when they need it. We've done that successfully throughout this pandemic, but we have seen an increase in hospitalizations. Oh,
you just started on this. We just got you on the screen just this moment now, so you'll want to start at the top.
Oh, sorry. I mean, I got to start my speech all over again, Taylor?
Yep.
Anyway, thanks, Sharon. First of all, folks, thank you all very much for joining us this afternoon for the state's response to the coronavirus pandemic in this press briefing. I want to thank everybody for joining us and remind everybody that the pandemic is getting worse here in Nebraska, that we've seen rising cases and rising hospitalizations. About 7 weeks ago, we had about 200 people in the hospital with coronavirus. As of last night, we have 885. And we need everybody's help in slowing this pandemic so that we can make sure we provide that hospital bed, that ICU bed, or that ventilator to anyone who needs it when they need it. We have done that successfully throughout this pandemic. We are at risk of that going forward if we don't flatten this curve with regard to the cases that are spreading. And it's not a case of just spreading in places like Omaha or Lincoln. It is spreading all across our state, places like North Platte and Scotts Bluff. So we need everybody to pitch in and really remind ourselves of the rules that we have to be able to slow the spread of the virus and the tools we've been given. So for example, we really need people to keep that 6 foot of distance between you and other people when you're out in public. So for example, when you go to the store, keep that 6 feet of distance. Make sure you wear a mask when you go to the store. As you're shopping for your Thanksgiving turkey and so forth, only go to the, make sure you're going to the store by yourself, and really only go to the store once a week. We're asking people to work from home if they can. All the things we did in the spring to slow down the virus successfully, we need to do again this fall. So please keep those things in mind. Wash your hands often. That actually kills the virus. And we've also talked about avoiding the 3 C's, that those crowded places, close contact, confined spaces. If you are going to be in a crowded place, wear a mask. If you're going to be in a confined space, make sure you've got good ventilation there. And also that would be the time to wear a mask. And those close contacts is how the virus spread, right? The virus spreads from person to person, typically when somebody's within 6 feet of somebody who's been infected for longer than 15 minutes. So please keep all of those things in mind and avoid those places. As always, another great way to be able to help slow the spread of the virus is by using Test Nebraska. It's absolutely free to use. We don't sell anybody's data. TestNebraska.com. If you've got a profile signed up, you can go in and schedule an appointment. If you don't have a profile, you can create a profile. And we have tested, returned over 403,000 tests so far since the pandemic began. And this is a great way, again, especially if you're going to go, say, visit your mother or grandmother, get that test ahead of time, make sure that you don't have the virus. You don't want to carry it into somebody else's household. And again, what we see is, and why we need everybody's help, is that we see, talking to local public health directors, that it's informal gatherings that are creating the issues with regard to the spread. Sometimes when we're around other people, we don't, have the same sort of care when we're at home. And we do need to remember that, as in my case, when we had people over for Sunday night dinner, somebody may bring it to your household and then you'll end up quarantining for 14 days. So far, my wife and I have not had any symptoms. We're all feeling great. We had our dinner outside, so we had plenty of great ventilation. But you got to quarantine for 14 days. So please, and remember, there's no testing out of quarantine. Once you quarantine, you're there for 14 days. So please remember that. So again, follow our tool or follow the rules, use the tools, make sure that you're doing all you can to slow the spread here, really limit that mobility so that we're not spreading the virus here in our state and that we can get this curve tamped down so we can preserve our hospital capacity. Now, one of the things we've been doing this week is featuring coronavirus survivors. Many people who are getting the virus are going to have mild symptoms and going to weather the virus very well. However, we know that there are other individuals who will be severely impacted by the coronavirus. And especially if they're older and have underlying health conditions, this may put their life at risk. And certainly we've had 731 deaths in the state so far. So we want to remind people that even though most people may have a very mild case, we don't know who that will be for sure. So you should take care so that you don't get the virus, we slow the spread, and that you can avoid the health risks that go associated with having that virus. So as Taylor mentioned, Stephen and Schrader are here today. I'd like to call Steve up to the podium to talk about his experience with the coronavirus and share that with our viewers out there. So Steve, can you come up and talk a little bit about what your experience was?
Hi, my name's Steve Schrader, and I'm a COVID-19 survivor. And this is my wife, Ann, with me today. Want to say thank you to Governor Ricketts and his staff. Also a big thank you to Nebraska Medicine staff, Madonna Rehab Hospital, a lot of family and friends for all their prayers that were heard all across the nation, and also to the big guy. Thank you, Lord. With that, the first question they always ask me is, where did you come in contact with this? And this probably goes back, I was doing a lot of traveling, especially up to Minneapolis area in late February, early March, and flew. And about the middle of March, I started feeling like I just had allergies that went on during that time. I'm also asthmatic, and so as time went on with the allergies, I started getting congestion down on my chest. And that congestion just wouldn't go away. In fact, I even called in, and they prescribed for me a prednisone, which is a steroid. That didn't help. So on April 4th, I had walked from the bedroom to the kitchen, was out of breath, and we ended up going to Urgicare. And when we got there, they rushed us and told us to get down to the ER at University of Nebraska Med Center. And when we got in there, I was there for maybe 4 or 5 hours. Ann had to drop me off. She wasn't able to come in and see me at all. And I was there maybe that 4 or 5 hours, and then they said, next thing I knew, the lights went out, and they actually put me on a ventilator. And with that, that's why Ann's here, because she knows more about the next 37 days that I was at the med center than I do.
Yeah. When they called me that early evening to tell me Steve had tested positive for COVID, I was shocked. We were both very shocked. And Steve and I got a chance to talk one more time before they put him on the ventilator. At that time, I knew that was bad, but I didn't know how bad, and I certainly didn't know that he would spend the next 19 days on the ventilator. I was quarantined because obviously I had been exposed since we lived together, and probably the worst part of the whole journey was about a week into it, he was getting worse and worse and worse, and the doctors would describe his lungs as concrete. And they said he's just not getting any better, and they told me there was a very high likelihood he would not survive this. That was Easter weekend, and they were preparing me to come into the hospital so that I could be with Steve while he took his last breaths, basically. So gut-wrenching, to say the least. by the grace of God, many prayers, and an excellent medical staff at Nebraska Medicine, including Lindy Farr, who is a PA, Steve started to gradually get better. So yeah, day 19, he was pulled off the ventilator. He was still positive for COVID. He was positive for COVID for about 34, 35 days. So it was a long journey. During that time, I kept a Caring Bridge site to keep family and friends updated. It was very therapeutic for me to be able to journal and, log the progress each day. And of course, all of our family, friends, and people we didn't even know who were so anxious to hear how Steve was doing on a daily basis. So I was able to then finally see him a few times, actually during Zoom. I could see him with the hospital. He was out, but I could see him and talk to him. I wanted him to hear my voice, even though he was in a coma and on the ventilator. Since I couldn't be there in person, I needed him to hear my voice. So I sent a little voice recording up that they would play in his ear every so often, and I would have them put the phone up to his ear as much as they could so he could hear me, encourage him, tell him I love him, all of those things. Then I was able to see him in person once the van dropped him off at Madonna 37 days later.
So I was at Madonna then for 2 weeks. They said it'd be 3 to 4, and I'm going, no way, that's not going to happen. And so I was home 2 weeks after that. But a lot of people want to know what was post-COVID and that. So while I was on the ventilator, I did have AFib that had occurred. I had never had any heart issues. I also became diabetic during that period of time, and so that was tested. And the other thing was I had tremors very bad, and a lot of neurological issues, feet, legs, arms, and those have all gotten better as I've gotten stronger. When you're laying in bed for 37 days, you lose a lot of muscle strength too in trying to rehab. Today, the diabetes is under control, just with diet and exercise. AFib, I thought I was going to get rid of that, but they ended up putting a pacemaker in at a later date because they were worried about blood clots, and so they put me on a blood thinner, and that ended up causing some issues where I had internal bleeding with that, and so that's why I have a pacemaker now too. I still have the neurological, and I think there is also a lot of mental stress that when you have that, I'm considered what you call a long hauler now, that we're still learning what COVID does to us and what the long-term issues are. And I appreciate the opportunity for both of us to come in and share that with you. And do you think of anything else that?
It's Russian roulette, people that get it don't know whether they'll have slight symptoms, no symptoms, or end up on a ventilator for 19 days like Steve did and nearly died, and God forbid die, because a lot of people have died from this. So it's very serious, and it's nothing to take lightly, for sure.
And our mission, being as I was saved by a miracle, is to tell everybody. We've done a lot of that, working with the Med Center. Madonna is to get the word out, what a long hauler is and how COVID does affect us all. And so wear your mask, hand sanitizers, keep your distance, especially right now too. I would look at avoiding big groups and big events and that as well. So with that, thank you.
Thank you for the opportunity.
Thank you very much, Steve and Ann. I very much appreciate you sharing your story with us, and we're so glad that, Steve, that you've recovered. And thank you so much for sharing your story. And I think, folks, it's a great reminder, what Ann said about not knowing how it's going to impact people, especially with the Thanksgiving holiday coming up. And normally we would spend that with large groups of family potentially. This year, that's not going to be a good idea. We should all be making plans for that Thanksgiving holiday to be very, very small gatherings, because again, we just don't know, especially if we're going to have relatives around that may be at risk. We want to make sure that we're not endangering them. Again, we don't know how this is going to impact every person. So this year, as you think about Thanksgiving, think about a very small group of people that you're going to get together with. And again, follow our rules. If you can be outside, if it happens to be a nice day, that would be the best thing to do, is to be outside. Try to keep that social distancing, wash your hands often, all those sort of things. And as Steve said, wear your mask, because that will help slow the spread of the virus. That's one of the other key things. You know, at the end of the day, folks, masks are not going to be the only tool we have, but they are an important tool because it does work. So please continue to use your mask. Now, we also know our healthcare workers have been working very hard to keep people healthy. They've been working very, very hard around the clock, and even putting their own health and welfare at risk with this pandemic. And this week is Nurse Practitioners Week. And so we want to recognize the great work of all of our healthcare professionals, but in particular, our nurse practitioners. And so we have Tara Whitmire here, who's the president of the Nebraska Nurse Practitioners, to be able to say a few words. Now, Tara, ordinarily, I'd be here with a proclamation to be able to hand you and sign. Obviously, I can't do that virtually, but we will make sure that you have one to take with you so that you can show that to your colleagues. And again, we are so grateful for all your work. We know people are working very, very hard through this pandemic. So with that, I'm going to go ahead and turn it over to you to say a few words.
Thank you, Governor Ricketts. I'm happy to be here today. Thank you for the invitation. As he said, this week is National Nurse Practitioner Week to honor the critical role nurse practitioners play, who are championing the health of all Americans. The theme for this year's celebration is NPs Moving Forward, Today, Tomorrow, Together. The 2020 commemoration occurs as NPs combat COVID-19 and as the nursing community celebrates the International Year of the Nurse, coinciding with the 200th anniversary of Florence Nightingale's birth. Florence advocated for infection control and hygiene. Both are still so important today. Nebraska Nurse Practitioners, the state organization, represents all specialties of nurse practitioners. The purpose of the organization is to promote, develop, and support the role of nurse practitioners through high standards of clinical practice, legislation affecting healthcare, continuing education, peer support, professional leadership, and representation. There are approximately 2,300 nurse practitioners in Nebraska. I have practiced as a nurse practitioner for over 13 years, and it is a humbling and rewarding career. Nurse practitioners are working tirelessly to diagnose and treat patients with COVID-19 and to combat community spread, while grieving healthcare colleagues, family, and friends who have lost their lives during this pandemic. NPs provide high-quality primary, acute, and specialty healthcare services while focusing on health promotion, disease prevention, health education and counseling, guiding patients to make smarter health and lifestyle choices every day. NPs work to expand access to care in underserved communities, end health disparities, and combat systemic racism in healthcare. We realize the mental and physical impact COVID-19 is having on all healthcare professionals and appreciate the tireless hours that advanced practice nurses, registered nurses, physicians, respiratory therapists, nursing assistants, pharmacists, hospital staff, and environmental services has put in to take care of Nebraskans. We encourage all Nebraskans to wear a mask, physically distance, wash your hands, and follow the 3 C's. Avoid crowded places, close contact, and confined spaces, and stay home if you're sick. I sound like a broken record, don't I? Please take this into consideration as you are planning your Thanksgiving celebrations. We need to take care of each other. There is a proclamation here, Governor, so thank you very much for proclaiming this week National Nurse Practitioner Week. Thank you.
Great. Thank you very much, Tara. I appreciate it. Thanks for coming down. We appreciate all the work that nurse practitioners are doing. And before we get into questions and answers, I just want to highlight one thing again. We are seeing increasing hospitalization, and that means that all of our healthcare professionals, such as nurse practitioners, are feeling the strain of the additional COVID cases in the hospital. We put in a directed health measure we announced on Monday that went into effect Wednesday morning. And folks, if we don't bend this curve down, we will be taking additional restrictive measures with regard to our directed health measures. And that's why when Tara says she sounds like a broken record, she's really repeating the things that we need everybody to do with regard to the tools that we have, the rules that we follow. So please, please, please make sure you're doing that. We need to slow the spread of the virus. If we see hospitalizations continue to increase, we will be taking additional restrictive measures. So with that, I'm going to go ahead and get into questions and answers. I do have a couple that were submitted ahead of time, and I know, Taylor, you were going to also moderate this. I've got a couple here that I will be able to read, but then I think the additional ones that you have, Taylor, you're going to have to read. We're going to start with Ruta Alsinaida from KMTV. Her first question, has the government been tested yet, and when is expected to get the results? I have not been tested yet. Again, generally you need 3 or 4 days from your exposure to allow the virus to incubate before it'll really be picked up by any of the testing. And again, I want to remind people, you cannot test out quarantining. So even if I were to go get tested and the test would be negative, that would not actually allow me to leave quarantining. You are there for 14 days. Again, a good reason why to avoid some of those large groups. And also, we have had people, for example, test positive on the 14th day of that quarantine. So you cannot test positive or test negative and get out of your quarantining. So please keep that in mind. Are hospitals starting to resort to care rationing or turn away patients who are not as sick? So we've been working obviously very closely with the hospitals. And you may recall from our earlier DHMs, we had limited what hospitals can do with regard to elective surgeries. I know many hospitals are reducing elective surgeries, so that's part of our steps to be able to preserve hospital capacity. I don't have any reports of anybody being turned away because of this. We have a transfer center to make sure that patients get moved around to different hospitals so that they can get properly cared for. Well, I should say, I saw your story, Ruta, with regard to the kitchen table, taking it upon themselves to move to carryout only. And my thoughts on this and the DHMs and so forth. And certainly part of what we want to do is encourage people to slow the spread. And what Kitchen Table is doing is some of the things that we had earlier this year. We have not gone to that DHM yet. But again, as I mentioned, we may go to additional restrictions that may include that. So please keep that in mind and why we need to continue to slow down the spread, or we will be going to some of the restrictions we had earlier this spring. Given that local healthcare workers are saying that the situation is dire, why have the directed health measures not been at least as restrictive as we had this spring? So in the spring, we didn't have the same sort of resources that we have today with regard to things like testing and contact tracing and PPE. The Nebraska Accommodation Project wasn't in place yet. Our plans for at-risk communities like long-term care was not in place. And when we took those DHMs off, we stepped them back a step at a time. And so far with our DHMs, we've done the same thing. However, again, if we don't get this knocked down, we will be taking more restrictive measures. Governor Ricketts, you claim that you don't have the data on transmission rates to see if mask mandates are working. New York Times reported on Nebraska counties and showed that 2 counties with mandates, Lancaster and Adams, have the lowest transmission rates in the state. You've got the New York Times data based on those findings. Are you going to issue, do you justify the stance that mandates don't work? So with regard to wearing masks, I do believe masks work. And we've been talking about that for a long period of time. Specifically with regard to the New York Times, they are using data from the Atlantic magazine, which is not exactly a state sponsored, it's not an official state data source. So I think you always have to be cautious when you're looking at some of these data sources, even the New York Times. Specifically, your question was about Lincoln Lancaster and Adams County. Lincoln Lancaster is actually, for most of this pandemic, had one of the lowest transmission rates in the state. You may recall, even early on in the spring, they were one of the lowest transmission rates. And I believe the Adams County that you're referencing is not actually Adams County, Nebraska, it's Adams County, Mississippi, because Adams County cannot have a mask mandate on its own. That's just not, the directed health measures just don't work that way. Lincoln Lancaster, as we've talked about, has a special carve out in state law. The city of Omaha has a mask mandate that they passed through the ordinance. But those are the only 2 exceptions in the state to having a broad-based mask mandate. Having said that, in our DHM that we just published, we are asking every business that has patrons and staff within 6 feet of each other for 15 minutes or more to wear a mask. So this would be salons and barbershops, but really includes any other business where you've got patrons and staff that are closer than 6 feet for 15 minutes. And that does apply statewide. Okay, so Michelle Shively from Nebraska News Channel. Is the governor going to withhold federal COVID dollars from counties that require masks in courthouses, or reconsidering that decision? We will, the policy as it is still stands, but we will certainly reconsider that if there's compelling reason to do so. Danielle from NTV, we've received a few complaints about contact tracing from some of our viewers, saying that it is taking several days for anyone to get in contact with them. One lady said it took 8 days for the health department to call her. Is the governor aware of contact tracing issue, and is there anything being done to assist the health departments to make the process quicker? So again, this really goes back to our press conference we had early in the week where Ashley Newmeyer was talking about our contact tracing. In the chart that she showed, the state contact tracers are getting a hold of people with 85% of the time in the first 24 to 48 hours. So again, just as a reminder, the first line of defense for contact tracing is our local public health departments. They have about 175 people trained. The state also has over 1,000 people trained to be able to do contact tracing that we offer to our public health departments to be able to use as a supplement for their resources. Now, this is not something we're forcing on the local public health departments. It's voluntary for them to use it. We encourage all of them to use it if their local folks are not able to make the phone calls in a timely manner. I know, for example, Douglas County does use our vendors that we have at the state to be able to do that contact tracing. And the data that Ashley Newmeyer provided on earlier this week was specifically to the state contact tracer. So we have the data that we collect. Obviously, we share that with the local public health departments, but that's the data we have. We don't get the data specifically back from the public health departments on their contact tracing. But our data shows that, again, we're getting to 85% of the people within that first 24 to 48 hours. And I believe it was actually over 60% in the first 24 hours. So with that, Taylor, I believe you've got a couple of other questions that came in afterwards that we can get to, and then we'll open up to additional questions.
Our first question is from Don Walton, and he wants to know if the virus continues to spread and overwhelm hospital capacity as you've warned, what actions are you prepared to take? Would you do a mask directive, economic shutdown, or shelter at home?
So Don Walton's questioning just what may the next steps may be. And again, just want to reiterate what I said earlier, that folks, we got to knock down this curve. Okay, we got to flatten the curve here so that we are not seeing the increasing hospitalizations that we've seen. And if that doesn't happen, we will have to take more restrictive measures, such as we saw this spring. So all those options are on the table for going into the spring. Again, as I've long said, though, I oppose mask mandate. We need to teach people when to use a mask. I do believe masks work. And that's why we have it in our current DHM that if you are in a business where your staff and patrons are within 6 feet of each other for 15 minutes or longer, you have to be wearing both parties have to be wearing a mask.
Quenisha Frazier from KTV asks, with Pfizer announcing that they'll have a vaccine ready soon, what would the distribution plan look like for the state? What agencies could the governor's office work with to get the vaccines distributed?
So with regard to the vaccination plan, we published that on October 16th. So that's on our Department of Health and Human Services website. You just go to dhhs.ne.gov and you'll be able to find it from there. And what the broad or the high level plan is that we will be distributing the vaccine through our Vaccines for Children program, so VFC program. And that will go out through the local public health departments that then will work with other providers to actually do the vaccinations, or in the case of some of our public health departments, they may be doing it themselves, such as they do with testing, as an example. But generally, we're going to use that existing infrastructure of the VFC program so that we will be able to get the vaccine out that way.
And then she would like to know, once the vaccine is ready, how will it get to the people of Nebraska, or how soon?
So once the vaccine is ready, again, it will be distributed by the federal government through that Vaccines for Children program. And our local public health departments will work with a variety of, healthcare providers, clinics, hospitals, and so forth, and ultimately, Walgreens, CVS, that kind of thing, to be able to get that vaccine distributed. And again, just a reminder, So the priority is going to be for healthcare workers, long-term care workers, first responders, people who are most at risk. Those will be the first folks who get that vaccine.
The next three questions are for Dr. Antone, and I'll read them while you're making your way up here, Dr. Antone. One is, how many assisted living facilities in Nebraska are currently considered to have outbreaks? Do we know how many Icap are working with right now? And what are the expected procedures for assisted facilities when an older person who would be considered at risk but is not considered sick enough to be admitted to the hospital, what are they supposed to do?
The first question was about outbreaks throughout the state, and probably right now, our highest number of new cases is coming out of Scotts Bluff, Nebraska area, where their hospital is probably at their highest level of inpatients since the beginning of the pandemic. But overall, it's statewide. So outside of just particularly saying Scotts Bluff, we're still seeing, like the governor said, high volumes in the North Platte area, the Kearney, Nebraska area, the Grand Island, Nebraska area, the Norfolk area, and always specifically the Lancaster and Douglas County areas.
Do you know how many assisted living facilities are impacted right now?
Right now, the assisted living facilities that are impacted are at, I do have that number. There are, just to go over the numbers again, for residents is up to 2,095 residents testing positive, 2,181 staff testing positive. The number of facilities are 320 out of a total of 496, for about 64% of the facilities being affected. The deaths are at 256, which remains pretty constant over the last several weeks at around 35, 36, 37% of our deaths coming from long-term care facilities. I think there was a question in there about Icap, how many long-term care facilities are being evaluated by Icap, and that's something that our Icap team that's headed by Dr. Salman Ashraf through UNMC is constantly evaluating those outbreaks at those facilities. I can't say the number that he's currently evaluating. I know anytime there's an outbreak, we have Dr. Ashraf get involved immediately to make sure that facility is zoning the patients correctly. In other words, they are divided up into red zones, yellow zones, and green zones, depending on the risk of that patient. If they're testing positive but don't need hospitalization stay, they will stay in that long-term care facility in a red zone. If a patient's been discharged from a hospital as COVID positive, they'll also go back to that red zone for a while until they're out of isolation, and so on and so forth. So I think there was the last question in there, Taylor. I can't. That's it? That's it. All right.
Nicole's last question is for the governor. What are the chances of certain businesses being required to close again in Nebraska? How bad would the state's infection rate need to be in order to make that call?
So again, folks, we have implemented 2 new DHMs in an effort to flatten the curve here. We really got to knock this thing down. If we do not see the hospitalizations start to decrease, or at least the growth rate start to decrease, we will be taking additional restrictions, which could include, again, some of the things we saw this spring, which did close specific businesses.
Michelle Bandur from KTV is asking about a criticism from the teachers union saying that used an example regarding teachers catching coronavirus earlier this week, and they're calling on you to issue a statewide mask mandate. Is that something that you'd want to do?
So with regard to the former part of that, the example I used earlier week was just an example meant to highlight social gatherings. We have used several of those examples. Obviously, we had Kurth Bashir here earlier in the week, who was talking about his experience with a family get-together. I think I also mentioned the high school girls who went to a pumpkin patch and then also had a slumber party. So that was just one of several examples I was using about how informal gatherings are one of the areas that we have seen a lot of spread. And certainly if you talk to any of our local public health directors, I think that they would concur that that is one of the big areas that we see the spread of the virus is in those informal settings, and not in the school settings itself, which our teachers have been doing a fantastic job of structuring the environment there. Kids are wearing masks, they're spaced apart when they can be. There are folks get a lot on hand washing and hand sanitizing and so forth. So in that structured environment, we're not seeing the spread of the virus, and that's really one of the things I wanted to highlight there. Was really more about the informal gatherings. With regard to the second part of a mask mandate, again, we've discussed that we've got that in the DHM as is, and I'm not going to do kind of the statewide mandate that we've seen in other places.
Matt Olberding from the Journal Star is asking about a vaccine. He says that Great Plains Regional is expecting the vaccine before the end of December. He's wondering if you could provide an update on where things stand and about how hospitals will play a role in distributing that vaccine.
Yeah, this is similar to our other question with regard to vaccines. The VFC program, the Vaccines for Children program, is the infrastructure we're going to be using to distribute those vaccines. They'll go out through our local public health departments, and they'll work with the different hospitals and clinics and so forth, or maybe groups like Walgreens and CVS to be able to get those vaccines out. We've published that plan, so you can go onto the Department of Health and Human Services website and see that plan. It's all out there for anybody to take a look at. Again, dhhs.ne.gov. You can go search there to find it. And again, I want to emphasize that it will not be for broad distribution initially. The last I heard was we are expecting to have, or we're hoping to have at least, a vaccine in December. There's a number of vaccines that are, being evaluated by the FDA right now. But if we do get that in December, those will be prioritized for our healthcare workers, for long-term care workers, first responders. Then it'll go to people who are most at risk. So again, we're going to have a priority setting, and again, that's all published in the plan we've got out there on the website.
We have a question from Martha Stoddard at the World Herald. She says that the state mandates that people not smoke in public places, even though some people don't like it. The state also mandates that people wear seatbelts, even though some people don't like it. What makes mask wearing different?
Well, we've covered this. Again, I think that when you've got mandates out there, it breeds resistance. And what we want people to do is understand the tool that we have. It's not the only tool, by the way. Keeping that 6 foot of distance, washing your hands, staying home when you're sick, de-densifying your workplace, working from home when you can, going to the store once a week and going by yourself. These are all the other tools that we have. So masks are just one of those tools. And while I believe masks work, they're just one tool. And so what we want is people to understand and adopt all those tools. And that's, again, that Swiss cheese layer thing we talked about earlier in the spring, how it's layering different NPIs, or those non-pharmaceutical interventions, on top of each other to be able to get the effect we want. And that's what we want people to do, is layer all these things on top and understand the tools and use them appropriately.
Rob McCartney at KTV is asking, what are your thoughts on a group that's planning to shop at an Omaha grocery store without masks? Do you support or oppose this group shopping without masks?
So with regard to shopping without masks, again, we're saying, folks, you really need to be wearing a mask when you go to the store. And of course, that store's policy will really, again, it's private business. So if their policy is you can't enter without a mask, then the store would be well within its rights to deny those customers the ability to come into the store.
Joe Dake at the World Herald says some think schools contribute to the spread of coronavirus, and others say there's little spread in schools and that schools may actually deter spread by keeping kids masked and sanitized for half their working hours. Given the spread of the disease, is it time to close schools and go back to full remote?
Yeah, actually, again, if you talk to our local public health directors, so we've got a consensus, and we've talked about this quite a bit, with the great job our teachers and administrators are doing in the schools with regard to structuring the environment there. I just talked about that a few minutes ago with regard to wearing masks, spacing kids out, focus on hand washing. We believe that kids ought to be in the classrooms. And this is another thing we need to be thinking about too, just broadly speaking. We spent a lot of time talking about the coronavirus, but the types of restrictions we put in place have other health effects as well. So for example, if you look at the Kim Foundation, they put out some data in the Douglas-Sarpy County area that showed that suicide rates among young people, I'm going to say 19 or younger, has doubled from this year from last year. And those suicides are actually 10 times higher than coronavirus deaths for that same age category. So there are other health costs that go along with the restrictions and why we think it's important for kids to be in school. Kids not only get the academic progression, but they also get socialization, mental health care services, nutrition, physical activity. So there's a variety of benefits kids get by being in that classroom. And frankly, some kids are just not going to do well learning remotely. And so that's why we think it's so important. And again, we've got a broad consensus from our local public health departments that if at all possible, keeping kids in the classroom is the best course.
Grant Schulte at the AP wants to know what sort of additional restrictions might you put into place?
Well, Grant, I would just refer you back to the restrictions we had earlier this year in the spring, and for some guidance with regard to what additional restrictions we may take going forward.
Becca Costello has a question for Dr. Antone. With the statewide positivity rate surging so much, how much community spread are we likely missing, and how does that increase impact the state's testing strategies?
Well, as you know, one of the reasons we are increasing our number of positive cases is because of how much more testing we're doing. So I think by doing more testing, we're getting a better idea of what the actual prevalence is in the community. And so we're seeing that increase, albeit we are seeing an increase in our test positivity rate. We know we're going to get more cases by testing more people, but at the same time, we are seeing our positivity rate go up somewhat. So what the prevalence is, I can just tell you that Nebraska has now tested 33% of its population with the number of tests that we've done combined. And up to this point in time, about 4.7% of the population of Nebraska has now tested positive. Now, this number has changed as far as what you do about what your number of positives are in your state. And sometimes people say you can multiply it by a factor of maybe 3 or 4 or 5, and that's what your true prevalence rate is in the community. So using our rate of around 5%, maybe our prevalence now is around 10 to 15% in the community. There's no doubt about it, though, that we are seeing an increase in the spread of the virus throughout the state. And I have to have my chance to say, please, we need to slow this down. We have to do what we did back in the spring. We have to limit our gatherings. We have to wear our masks. We have to wash our hands. We have to slow this spread because we know that as more and more people test positive, we're going to increase hospitalizations. And we have to turn that trend around. Otherwise, we will have an increase in hospitalizations to the point, like the governor said, we're going to have trouble with patients being transferred to hospitals. So please, please follow those 3 C's for us.
I think we're ready for questions from here in the room.
Hi, Governor Brian Maxbury from WOWT. You say mask mandates breed resistance. The resistance is already there. Aren't you tired of telling Nebraskans to do the right thing when that's not working?
So Brian from WOWT, I don't know if you heard his question, is asking, we already have resistance to mask mandates. Are you tired of telling Nebraskans to do the right thing?
I think it's an education process. Again, masks are just one of our tools to be able to slow the spread of the virus. We have a number of tools we want people to adopt, and so we want to do the education about all of them. And that's what the process is about. It's about that process of education to help people understand when masks work, what the best tool, the tool is at the time, and to overlay those different tools, like we've talked about in the past. Certainly this spring, we talked a lot about the Swiss cheese analogy, to have layered NPIs, and that's all those things we talk about with regard to the 6 foot of distance, with regard to washing your hands often, staying home when you're sick, shopping alone and doing it once a week, staying home to work if you can. These are all the things we can layer on.
Can we freeze up?
We need to get back to those good habits that we had this spring.
Governor, if you'd repeat just the last 10 seconds, you froze up for a moment.
Oh, I'm sorry. We need to get back to the good habits we had this spring.
Okay. Next question.
Governor, as you probably know, there's been a series of social media posts by doctors
So we had Fred Knapp is asking about social media posts from doctors at UNMC, particularly one from Dr. Dan Johnson, saying that the most recent DHMs are insufficient, and he wants to know your reaction to that.
Yeah, we're continuing to monitor the hospitalization increases. And as I've said, if we don't bend the curve here, if we don't flatten it, knock it down, we will be taking more restrictive measures. So we are monitoring it. We're going to continue to see, and again, this is why we're asking Nebraskans to use all those tools that we've given them with regard to slowing the spread of the virus that we've talked about. And we're going to continue to monitor. And like I said, we're going to take more restrictive steps if we need to.
And Fred would like to know your timing on taking more restrictive steps or making those decisions.
Well, we're continuing monitoring it, so I'd say just stay tuned.
Brian has another question.
If I could follow up on that, Governor. So your DHMs, you say you're that guy. Take about 2 to 3 weeks before you start to see the results. Right now, there are 268 beds that are staffed in Omaha. There's 372 patients. By their math, in 3 weeks, they will already be overrun. Shouldn't changes be made now before we're in the crisis mode?
So for the benefit of the viewer, Brian from WOWT says that the beds in Omaha will be full in 2 to 3 weeks. So wouldn't that be too late to consider new DHMs to protect hospital capacity?
Well, Brian, we're continually monitoring the situation. We have phone calls. Dr. Antone is talking to the CMOs at the various hospital systems in Omaha and Lincoln, really on a daily basis. I have conversations with them as well. So we're going to continue to monitor the situation and take the steps we think we need to be able to maintain the hospital capacity.
Next question.
I have a question for Dr. Antone.
Okay. Dr. Antone.
So I believe Governor Ricketts had mentioned that right now we're at 885 hospitalized people right now in Nebraska hospitals. Does this even include like some people who may be affected by like the yearly flu at this point? Are the yearly flu affecting the hospitals right now?
The question is the number of patients in the hospital with COVID diagnosis are 885 as of last night. And the question was, is that including like the seasonal flu numbers, or have we seen an increase in seasonal flu?
Like the higher capacity hospitalizations come with also, COVID patients and then flu patients as well.
Correct. So far, I've not heard from any of the hospitals that the seasonal flu is really impacting the hospital numbers. As a matter of fact, the closest CMO I keep in contact with for that is at Children's Hospital, who usually does see an increase in hospitalizations during the November, December, throughout the flu season. And so far, they've done pretty well with the seasonal flu. And that's what was seen in the Southern Hemisphere back during our summer, that their number of seasonal flu cases were not as high as they normally see, obviously due to our non-pharmaceutical interventions that we have in place for COVID. Let's hope that continues, and that's why everybody should go ahead and get their seasonal flu shot now. That will help decrease those hospitalizations in the future. And as the governor has mentioned, and we've heard today, we are anticipating the first phase of COVID vaccination to take place before the end of the year. And so we know there needs to be an interval of time between getting your seasonal flu shot and that COVID vaccination. So please, if you were a person like myself, who in the past would wait to get their seasonal flu vaccine later on in December or whatever, please get it now.
We have a question from Julie Anderson at the World Herald. She says, please explain how the state calculates its positivity rate. It differs from other available sources.
Yeah, so there's a couple different ways that you can calculate positivity rate. You can do it on the test date, which is you just look at the people who tested positive on that day versus all the tests that day. But generally, when you get those test results back, certainly if you're doing a PCR test, that actually was from a sample that was taken a couple of days beforehand, or really depending on how long that lab took to get the response back. In the past, for example, for some of the labs, we were seeing it take, some of the commercial labs were taking, as long as 8 days or longer. Certainly with Test Nebraska, we focused on trying to get that test result back in a shorter period of time, but there is a little bit of a lag between the time you take the test and when the result comes back. So what we do at the state of Nebraska is we look at when was that sample test taken, and then pair it back to the result, or pair the result back to the sample test. So for example, if we have a test result come back either negative or positive on a Friday, we'll go back to maybe Wednesday or Tuesday to pair it up with the time that test was taken. And so that's what you see on the state's website, is that we're taking that sample date and pairing it back to when the test was actually taken, and then calculating that as the test positivity rate. Now that means we publish it once a week on, usually for Sunday data. We will update it for a couple of weeks back, because sometimes those results come back over the course of those weeks, and that's why the previous week may change as well. So that's the way we do it at the state. Now, I know other people what they're doing is they're throwing out all the tests from somebody who was previously tested. So for example, if somebody had tested 10 times, what they might do is say, okay, I'm only going to count your first test, even though you tested in 10 successive weeks. I'm throwing out all the other 9 after you first tested. I don't believe that actually represents an overall prevalence in the current community, because you're throwing out test results of somebody who's already tested, even though every test is a unique test, right? I can test negative one week and the next week test positive. So you shouldn't throw out those negatives for those 9 succeeding weeks. Let me just share a little math example of how this might work. Say, just as an example, you have 100 people test in week 1 and 10 of them test positive. Then you'll say, well, for that week, it was a 10% positivity rate. Now, let's say the next week you have another 100 people test, but say 50 of those people tested in the first week. You get this, and say you also get 10 people test positive. Well, if you have 10 people test positive and you're not counting 50 of those test results because the people tested the week earlier, you would say that your positivity rate was now 20%, right? 10 out of 50 versus 10 out of 100. Well, you can see though, but you only had 10 people test positive in the second week, 10 people test positive in the first week. It's not quite so simple as to say, oh, my positivity rate has doubled, because I've thrown out the test results for half the population tested because they had tested the previous week. So early on in the pandemic, that didn't make much of a difference because we had limited testing. A lot of people weren't multiple testing. Now, if you look at the state's website, you can see that while we've tested, about a third of the population, as Dr. Antone was saying, over 600,000 people have tested. We've got over 1 million test results back. So you can see people are testing multiple times, and that's what could skew your positivity rate. And that's why we at the state do it, where we're really marrying back that sample back to the test date so we can get the most accurate. Now, it does mean that it's coming back in arrears, but we believe that's the most accurate way to measure it. And Julie, I'm sorry, that might have been way more explanation than you were looking for.
Other questions, Brandon?
Going back to the vaccines and the reference that they'll be prioritized for first responders and those healthcare workers, does the state have a tally of that number? And then also secondarily, do you know how many vaccines you'll get initially?
So Brandon from News Channel Nebraska is asking about, we have our priority groups in our vaccine plan. Do we know how many people are in those groups, specifically first responders and healthcare workers? And then do we know how many vaccines we're going to get in the first batch that'll be sent to the state?
So with regard to that second part, we do not know how many vaccines we're going to get if they're available here in December. I think that number is still up in the air. The federal government, the last I checked, had not made a determination. They were either going to do it on a per capita basis or some sort of per capita at-risk population basis. So here at the state of Nebraska, I think that when we were asked our feedback, we were really we could go either way, either per capita or per capita high-risk population. But either way, they did not tell us how many of those vaccines there would be. And a lot depends on which vaccines make it through the testing first and get to us. So I know the federal government is producing dosage of those vaccines even before they got the FDA approval. But again, I don't know how many they've done. So that's kind of your second question. The first question with regard to how many in each of those different groups, I don't know off the top of my head. Taylor, can we just take that as a note to do the research and come back, and maybe we can get Brandon that. And it could be our public, Dr. Antone knows off the top of his head. I don't have that data at my fingertips.
I don't know the answer, Taylor, specifically for the numbers, but I know the government does know those numbers, and we also, our vaccination team knows
So Dr. Antone says that our vaccination team should know those numbers, and we can follow up with Brandon to ensure that they get back to him. And Brandon has another question.
And lastly, are volunteer firefighters included in that number?
Brandon's wondering if volunteer firefighters are included in those priority category groups.
Yeah, as first responders, volunteer firefighters would be included in that category.
More questions?
I have a question for the
Brian.
trainers.
Welcome, come back up.
I'm glad you're feeling better.
Thank you.
Where are you guys from?
Omaha,
Omaha.
yeah.
So can you say, do you know where you got it, and did your belief and precautions about COVID change from before it to after?
I don't know where I got it exactly. I mean, you can always guess, but you got to go back to February, the end of February, first part of March. We were just being introduced to COVID and really didn't know what the effects of it were going to be. I was on planes, I was around large groups of people in late February and early March. When I got out, we've been strong advocates of wearing a mask, social distancing, cleaning your hands, covering your mouth when you cough, those things. But the thing that I notice is, you know, we even talk about mandates. Some people aren't going to wear a mask no matter what. And we see that as we go into a grocery store, you know. It is frustrating to me. It was frustrating to me. We would visit a local grocery store and they had arrows of what direction you should be going. And people weren't always following those, but they also weren't wearing a mask during that period of time either. So that is frustrating to me because to me, they haven't had a loved one that has had to endure the COVID and what the symptoms are of it. That's why we love getting our message out and talking to people about it, because we're witnesses for it, you know, and we will tell that story all over.
How are you doing Thanksgiving different?
Not as many people.
Yeah,
You know,
a
very-
smaller group.
Very small group, so not very many people at all. And everybody understands why.
Well, and unfortunately, we had to deal with a funeral even that was about 3 weeks ago. And we will have that service will be at the gravesite probably in the springtime because of that, you know. So, but I think everybody just needs to be careful because we don't know how it's going to affect everybody. We see so many people that are asymptomatic. We see, but you got to think about the elderly and the people that are more vulnerable. And those are the ones that we need to really watch out for. Mm-hmm. Yeah, thank you.
We have time for a final question. Seeing none, Governor, did you have any closing comments that you wanted to highlight at all?
Well, just that, again, we're going to continue to update people with regard to the hospitalizations and our DHMs. We're going to have a press conference tomorrow at 10 a.m. We'll have a press conference on Monday at 10 a.m. We'll have a press conference Tuesday at 2 p.m. And then on Thursday at 10:30 p.m. or 10:30 a.m. rather, we're going to be doing our awareness campaign kickoff that a variety of folks across the state have been working on. So encourage everybody to tune in then. And then finally, again, folks, again, if we don't bend this curve, we don't flatten this curve, we don't knock it down, we are going to be going into further restrictions. So please help us all out. Follow the rules, use the tools. Let's flatten this curve. Thanks, Taylor.
All right, thank you and have a great day.